Hello and good evening wherever you are, and welcome to the EMTG webinar. My name is Joris and I am with Raquel this evening. Um, I will be going through a little bit of a presentation with some talking points about the Dutch healthcare system and the Netherlands in general. And right after that, we'll be having a Q&A with Raquel. Uh, to start with, as I said, my name is Joris. I'm the recruitment coordinator at EMTG Healthcare. And in the past, I was a nurse myself as well. So I worked around Amsterdam mostly. So I'm joined here by Raquel. I will uh, let Raquel be a surprise as in terms of introducing herself. For the end of the presentation, I can flick through all the information first. But Raquel is our ambassador, and she is working right now as a nurse herself, also in the Amsterdam region. So in terms of talking points, we would like to tell you about why you should choose the Netherlands, of course. We're also going to be talking about nursing in the Netherlands, how the healthcare system works generally, what are the roles and responsibilities from nurses, and of course the salaries as well. Then, if you're considering going on an adventure like this, then it's always important to choose the right organization to do it with. So I'm going to talk to you about why you should consider or choose EMTG if you are considering going to Netherlands. I'm also going to be to talk about our language course, which is a big part of our whole operation and also really an important part in your journey. And of course, we're going to end up with the Q&A with Raquel. So to start with, why choose the Netherlands? Well, there's a lot of reasons. If I just go through the PowerPoint, you get a high quality of life with a strong healthcare system in an international work environment and a lot of opportunities for career growth. But when you dive deeper into those points, the high quality of life basically comes from the facilities we have in the Netherlands. It's a small country, so all the facilities you need are right around the corner, so to speak, and they're from high quality as well. Also, the Netherlands is quite noticed about their work-life balance. So we are the least working country in the whole of Europe with an average of 32 hours working hours per week. Um, but still, we managed to have a pretty strong economy and in that way, a good work-life balance, which also encourages um, overall happiness. So we have a strong healthcare system. We have a lot of universities in the Netherlands that are working with hospitals as well. So there's a lot of studying being done, a lot of research being done in the Netherlands, where an international group also finds its home base. So that makes it also really an international work environment to work in. Not only is the Netherlands pretty diverse in terms of ethnicities, but also a lot of expats are choosing the Netherlands to continue their career and even live there as well. But the healthcare system in the Netherlands also comes with a personnel shortage. We're not with a lot of people in the Netherlands, but we have a big patient population, and that will continue to grow over time. And that's why the organizations and hospitals and care institutions, they all try their best to keep the nurses within their own organization. So they offer them career growth in terms of promotion, in terms of studying on their behalf. So a lot of opportunities lie in the Netherlands. So when we dive deeper into the role of a nurse and the nurse system in the Netherlands, so I won't go too deep on this because, yeah, it's not that important at this stage, but it's good to know that everyone in the Netherlands or who is residing in the Netherlands is obliged to pay a monthly fee that goes to general health care. So that means we have a universal coverage of healthcare. Um, and what's especially important to know is that we have like the structure of gatekeeping. So when you have a health issue, you first go to your GP, your house doctor, if you translate it literally. You will tell him or her your difficulties, and they will prescribe usually paracetamol. That this is a bit of a running joke in the Netherlands. You go to your GP with symptoms, and you go back home with paracetamol or just a very over-the-counter medicine. Uh, but of course, when it's serious, you'll be transferred uh, to a specialist, usually in a hospital. They will do some further research. But in this trickle-down structure, we make sure that every euro is spent very efficiently in the Netherlands. Also, fun fact about the Netherlands, we're all about efficiency. So take that as you will. This is generally the healthcare system. So everyone pays a premium every month, um, and the system is very efficient, but also it's very packed as well with patients. So again, a lot of shortage in the coming years. So uh, all the help from other countries in Europe are very welcome, and it also is being encouraged. So as a nurse, we have, or as nursing personnel, we have different types of levels, and every level comes with its own level of responsibility. So the higher level you are, the more responsibility you are. That also means your salary is higher. Um, so we begin at the level 1, 2 nurse, which are primarily care assistants. So they do the very basic of care, but they're very important in the overall process. You will have a lot of help from them. Uh, then you'll get the level 3 nurses, and I want you to pay attention to especially the level 3 and the level 5 nurses, because if you are a nurse in Europe and you have a Bachelor of Nursing degree, these are the two levels you'll be working as primarily if you come to Netherlands and work with us. So a level 3 nurse is an auxiliary nurse or a nurse assistant. We don't really use these kinds of names, um, but generally they do around 80 to 85% of the nursing tasks that you will expect from a registered nurse. So they're pretty essential in the general care every day. You'll see a lot of this type of nurse in nursing homes, disabled care. Uh, you won't see it as much in hospital care, um, but still in a big part of the nursing structure, you will encounter these type of nurses. The level 4 nurse, this is specific a Dutch qualification. It's in terms of what they do and what kind of responsibilities they are. It's very similar to the level 5 nurse. So I will just skip this one, go to the level 5 nurse. These are the nurses with a Bachelor of Nursing degree. So overall, they have the general nursing tasks, as you might also do at home, the technical stuff. But there's also a little bit of a leadership component required in this role. So and then after that, you get the level 6 to 8 level nurse. So you can become a nurse specialist, where you can even diagnose or prescribe medication, usually in collaboration with the doctor, of course. So going back to the level 3 nurse, so our nurses, when they come to the Netherlands, they will have, of course, they will have to pass their language exam. Like this is an official exam, which will we, of course, prepare you for in our language academy. And after, if you pass that exam, you will have all your documents ready in order to get your nursing registration. This usually takes around 12 weeks at the max, usually a lot sooner, but um, because you already have, you already want to start working, of course, you're already in the Netherlands. So with your diploma, you can already begin as a level 3 nurse. This is also a very good starting ground to try and adapt to your new environment, to the language level, your colleagues, without having all the complex responsibilities that are required from a level 5 nurse. So there's always a little bit of a training ground at first, so you can again adapt to your new situation. In terms of salary, these are very general numbers, and I will just go over to the registered nurse part. So these numbers go up every year because the salaries are all being negotiated for every year again. So these are very general and very a broad range of numbers. So you can expect this kind of number when you have specialized as well. So it will be a bit lower when you are working as a registered level 5 nurse, but still this is a broad range. And when you of course get a contract from us, you will have your specific salary. But just to give an indication, this is it. And this goes up every year as well. Also, when you're already started, you will get a higher pay in the next year in your contract. So the career path of a nurse in the Netherlands, if you join EMTG, you begin as a level 3, then you go to a level 5, and then usually you're out of your contract with EMTG after that, and then you can see if you want to pursue a career as a nurse specialist, or you can even do your master's. So but you can also quit at level 5 and just do that, which is also very fine. You can work anywhere in the Netherlands at any department. So don't let anyone hold you back in terms of what you want to pursue. So in terms of job offers, we work throughout the whole of the Netherlands. We have had clients before in the most southern part. We have a client right now around here, but we also used to have clients around Rotterdam, Amsterdam. So we have a pretty broad um, uh, theme to choose from. So why you should join EMTG Healthcare? Well, we have been around here we were one of the first who actually done this and uh, support nurses from all of Europe to start their career in the Netherlands. So in that time we have a lot of experience and make sure we try to make the experience as smooth as possible. So yeah, so it's been around 900 healthcare professionals up until this point. So what we provide is job security. So we make sure you have a job before you arrive in the Netherlands. You'll be also have handed a contract. So no matter what happens, you will be secured of payment as well. Um, we find an individual approach very important. Because everyone is different. Some people need more support than others. Uh, you can also expect us to support you in your Dutch language lessons. Um, we have a thing we call job mentoring. So you will be assigned a job mentor, usually also a nurse with experience in the Netherlands, who can help you get on track and adapting to your new situation. We also help you with your nursing registration, of course. It's a bit of a bureaucratic uh, scheme, but we know how to deal with it, and it always works out. We also make sure you have housing to live in as well, because we don't want you to live in a tent or anything. And any other questions you have during your stay in the Netherlands and your stay with us, we can help you and manage it accordingly. So a big part of our program is the Language Academy. This is a course of 4 months. It's pretty intensive. It's 6 days of studying with classes in person. And this all happens in our academy in Spain. So we chose Spain a while ago because a lot of our candidates come from Southern Europe and especially Spain. So we want to have like a buffer zone where they are not that far away from home, so they still feel confident there, and but also have a lot of room to learn the language. The language courses are given by Dutch teachers, also teachers with a nursing background. So the emphasis during the language course is really upon the healthcare system. All your classmates will be also be working in healthcare as well. So it is not a general language course. This is fully focused on healthcare and patient interaction. So you'll be fully prepared when you arrive in the Netherlands. So we also do Dutch festivities such as King's Day, Sinterklaas. But you will find out what it is when you get there. So this has been a really quick part through the presentation. I assure you, if you have if something was a little bit fast, you can always ask it again when you are in your interview with one of our recruiters, and they can help you out further. I'd like to go through this part pretty quickly so we can move on to the Q&A, because this is where I think the most interesting points come from. So if you want to join in on the Q&A, there's a Q&A button above, and you can insert your question. But I already got some questions beforehand. So Raquel, if you'd like to give a short introduction about yourself at first, and then I will shoot you some questions.
Yeah, sure. So my name is Raquel. I'm from Spain, from Valencia, and I moved to the Netherlands at the beginning of 2019. So it's been already 7 years. I started with EMTG and I did a course, I remember, like at the end of 2018. So I did get like the Christmas break. And after that, I moved to the Netherlands, worked a year and a half in psychiatry, then moved to the hospital, did a lot of different services, and then I ended up working in prevention healthcare, which is what I'm doing still nowadays. So, yeah.
Oh yeah. You had a pretty good career in the Netherlands, and so
Yeah,
you've
did a
been
little
you've
bit of
been
everything.
yeah. I always say that Raquel speaks more fluent Dutch than I do, and I was born and raised in the Netherlands. Going over
Yeah.
to the question. So I've got a question here. So you arrive in the Netherlands, everything is new for you. I'm sure maybe you have been already to the Netherlands, but you come here as a nurse. Uh, so what are your first impressions of working in a Dutch care facility?
So, my first impression was that it was way better organized. Like you said, Dutch people are really efficient and they always have a plan for everything. And the very first thing that I had to learn in my job was like the protocols. Because like you're never gonna do anything without knowing why or like what you have to do in each situation. And also, I don't know, people were like really warm, which I hadn't expected for like Dutch people. But I remember my very first experience, like in my first job in the Netherlands, my Dutch wasn't that good because, of course, I had only done the like 3-month course. And they were really helpful. They would really take the time to encourage me to learn the language, to read some extra stuff that will help me with my vocabulary, or just like make me feel a little bit more at home. So yeah, was a nice experience.
Yeah, and you already talked a little bit about some differences or some things that stood out. So can you name some more cultural differences, and especially how that goes on in your like in the workspace?
Yeah, so if I talk about, for example, like the hospital life, which is like the most easy to like see the differences. Definitely the fact that you have less patients per person when you're a nurse. That was like really an eye opener, because in Spain I would have like 16 to 18 patients, and then in the Netherlands, I would have six on a very busy day, usually less. And you would have, of course, people who would help you. So that was the very first thing. Also, the second thing, like I said about the protocols, they also have, they're really advanced in the way they give medicine. So, for example, they always have like a double check up with another nurse, or like you have QR codes that you can scan to make sure that it's the right patient, right medication, right dose. So that really also stood up, because I didn't like everything that I had done in Spain up to that moment was like writing on papers. And then also I would say the fact that like they're really into learning about like all of the mistakes that people make, and like really talking about like a very special case that we have seen, for example, or like something that like we would have to know as nurses. So they really like to invest in the fact that you as a nurse know what you're doing.
Mm. Yeah, interesting. So um, a lot of people are, I would say, concerned about the language barrier. So how did you deal with that when you came to the Netherlands?
Well, I like my experience was very positive, because they didn't just like let me do my thing until I was really sure about what I was doing. So that was really like a big difference from Spain, because in Spain, for example, you would start a job and like 2 days later you would have to do everything on your own. And especially the program with EMTG, like they really make sure that you have a long process of a couple of months, even more, where you're just learning the language. You also have classes, and people know that you're from another country and you're learning the language, so they do try to make it easy for you. Of course, it was challenging, because you do have to, in your free time, try to learn the language, try to practice, and yeah, it just takes time. But I have, like, looking back, I did have a good experience with that as well.
Okay, great. And in terms of the technical stuff, so are there any differences between the nursing task compared with the Netherlands to your home country?
A bit. Usually, like one of the things that in Spain we don't do, because we don't really have the time to, with so many patients, is like washing the patients, changing their sheets, all of that. In the Netherlands, because you do have the time, you do it together with nursing assistants. Sometimes they would do it for me. Sometimes I wouldn't have a nurse assistant, so I would do it myself. So that's one of the things that I did have to learn. And then also there are a couple of skills, like you said, in the Netherlands, there are a lot of different levels. So here it's like really differentiated, like every level has its own things. So for example, you cannot work in an emergency care without having that specialization. So you also cannot do the techniques that you would do in an emergency if you're not an emergency nurse. So I would say that's a bit like more the difference, because for example, in Spain, you don't have like an ICU nurse. So as a normal nurse, you would have to do like all of the machines that's work in an ICU. So that's also a bit different.
Yeah, so you deal with a lot of levels in healthcare in the Netherlands.
Mhm.
Everyone has their own level, um, but you still have to collaborate, of course. So I got a question. How do you experience the collaboration, especially with doctors and other colleagues, of course?
Yeah, it was actually a bit better than in Spain. It did feel more like we were one team. And in the hospital, it really depends on which hospital you're working. Like if it's maybe like the biggest hospital in the Netherlands, very academic level, it might be different. But in smaller hospitals, you do feel like you're a team. They sometimes also like we call each other like with a first name, which is also a big difference from Spain. And right now I work like in preventive healthcare, and sometimes we work with the doctors that have less experience than the nurses itself, because they just graduated and they come to the job and they ask us for advice. So we also have like that level of confidence where like a doctor can go to a nurse and ask for their advice without making it feel like it's weird, like you're downgrading yourself. So that was really nice.
Hmm. Yeah. So is there something you would take from the Dutch healthcare system and you would like to bring that back to Spain? Is that something you would like to see in other yeah in your home country or maybe other countries? Or
So
especially and the other way around. So is there something
yeah.
that the Netherlands is missing?
So besides the salary, which would be the first one I would say, definitely the fact that it's like so well organized. So like not only the protocols, which are really like it's so amazing because you just start in a new place and then you really know what to do in every situation, or where to find how to behave in every situation. So that's really nice for especially new nurses. But also the fact that like every place where you work has like their own way of accessing it. So if it's something that's gonna be like a bit more complicated job, like the ICU, emergency care, pediatrics, you have to go through the studies first before you really can do the job. So that's really nice because it makes you feel like you are more well prepared to do the things that you're supposed to do. And also the stability for sure, because in Spain you would just work like one weekend here, another weekend there, and in the Netherlands you always get at least 1 year contracts. And then if I would have to say what I would bring from Spain in my case to the Netherlands, I would say the fact that like in Spain everyone is like really quality driven. So even though they don't have the time, or they sometimes have to pay their courses that they want to do on their own, nurses really want to be the best nurses they can be. And I feel like sometimes in the Netherlands, because you really have all of these endless possibilities, people get a bit more comfortable. So maybe that's I would change.
Yeah, nice. So there's also, of course, yeah, you have your private life outside of work. How did you manage to, or how was it to acclimatize to that part of your life?
It really took a bit longer, also because we had COVID in between. So I did have, luckily, a couple of Dutch girls that I already met right before COVID. They were like my roommates, and then we during COVID we would do a lot of stuff at home. So I got to learn the language, but also got to learn like more their culture, how they are. So that made me feel more at home because, like with the years, I would meet more and more Dutch people through them, and I started to feel more like a part of the country, I'd say. But yeah, in the beginning, it does take a lot of time to feel at home because even though the weather can be sometimes really nice, usually it's a bit colder, it rains, people speak another language. Usually, people here eat dinner a bit more soon than in Spain. So, for example, when you're done with working in Spain, I would sometimes, go and have a beer or two with my friends. But here, everyone goes home, eats and works out, or works out, eats, and then goes to bed. So that's something that you need to get used to. But I would say the trick is like just, be friendly to Dutch people, see if someone wants to introduce you to some other people, and then at some point you'll feel at home.
Yeah. So is there something specific that you might that might be shared with more people if they decide to live? Is there something very general that you like about living in the Netherlands?
I would say the quality of life, because like you said, we work here a bit less hours than in other countries. In Spain, usually it's like 38 to 40 hours. And here, you work 36, a lot of people work 32 hours. You make enough money to be able to save, but also go on trips with your friends, do nice stuff on the weekends. And I also feel like Dutch people really know how to enjoy life, because when suddenly one day it's sunny after like a few weeks of being cloudy, everyone is gonna go outside, want to make plans. Everyone is like super happy and enjoying life. And I feel like in Spain we do take that for granted. So yeah.
Mm, yeah, nice. So, going over the little bit of the technical bit. So, you're a registered nurse now in the Netherlands, and you came here as a nurse. So, how was your experience in getting your qualifications recognized here?
So like you said, it was actually quite easy because the people from EMTG helped me. The only thing we had to do was like the language test, like the B1, and then once you get the certification of like that you've passed the four exams, then you just need to like send them a couple of documents that they already like previously told you to get from Spain. So the process itself was very quick. It didn't take me a lot of time. I think in my case was also like around 3 to 4 months with like exams, getting all of the papers, sending them, and all of that. So it was really easy, honestly, and you always have someone who can help you.
Yeah, great. Um, can you remember how long it generally took to get recognized?
Um, I started working like beginning of February, and I remember before the summer, like around the summer, I was already
Hmm.
working as a nurse.
Yeah,
And
that's
usually, the moment you get your date, like, they just change the contract that day, so it's really quickly.
yeah. Did you have any difficulties to going from the level 3 to the level 5 nurse?
Not at all, because in my job, they would always show me what was expected of me as a level 5 when I was level 3, just so that I would know how to prepare myself.
Yeah,
So the only difference is that I couldn't give medication, or I couldn't do a couple of, different techniques, but I knew how they wanted to do it. So the moment that I got my big registration, I just started to do it. So it was really quick also.
great. So big registration is the nursing registration in Netherlands. We call it the big registration. Um, so there might be some nurses like really watching right now and considering going to Netherlands. Is there any advice you would give them?
I would say, if you're wanting to, like, make such a big change in your life, um, just accept that, it's gonna take a long time to feel at home and to learn the language. Because I sometimes get questions of people who want to come for a year. I don't think this is a process that you can do like in such a short time. But if you're willing to spend here a few years, it's definitely worth it, because you're always gonna take all of the experiences, everything you've learned. You're always going to take that home if you ever decide to move back. And once you start to, understand the language a bit better and understand the culture, it gets really fun. So, yeah.
Yeah. And I can imagine if you have learned the language and invested so much time and energy into everything, uh,
Yeah.
I don't expect you to wanting to go back like within a year. So, uh,
Yeah,
but yeah,
exactly. It's such a long process that you really want to take the most out of it. So,
yeah. So I have a question here, like, how do you see a future in Netherlands for yourself, or do you plan to go back home one day? How do you see that?
so I do see myself staying here in the Netherlands, also because I have a Dutch boyfriend. And we bought a house, and we would like to have a future together if we can, like maybe in a few years have kids. So of course, if I want like the stability that I would want for my future family, this is the best place to be. And like you said, once you've been here for a few years, you've learned the language, you've learned everything, it kind of feels like it's been a process that, like, in the beginning it's a lot of work, and then after a few years you just start to feel like, everything just makes sense. And I've really gotten lucky with like all of the friends that I've met here in the Netherlands. So my life is too good to go back, I would say.
Well, that's a nice thing to finish this webinar on. So for you, it's all everything has worked out. I'm sure you had your I'm sure there were some difficulties. It's always a big step when you decide to go and move to another country and also work there. But also because it's healthcare, because it's very communication oriented. So the language, you have to really, you have to master the language, especially if you want to grow in your career. Um, so it's good that you still after these years you still have the motivation to keep going. But also I think uh, you keep becoming better. Do you have a feeling that you still that yeah that you are really growing still in the language wise, or
Yeah.
are you feeling like you're becoming a Dutch person? How can you?
Yeah, I mean, I feel very Dutch, to be honest. Even like when I speak English, I feel like my accent is more Dutch. But yeah, like I feel that you never really can master a language 100%. Like the moment that you can participate in any kind of conversation, then you want to be more specific with the vocabulary that you use. Like for example, I would really like to study a master here in the Netherlands, so I do feel my Dutch is more like I'm very fluent with like the normal conversations that I would have at work or with friends. But when I have to read like a research paper, there are a few words that I still don't know. So I'm working on that right now. So I feel like even if I was here for like 15 years, there would still be something that I would, I could get better. So yeah.
Yeah, well, that's great. So Um, thank you so much for being so open with us and answering all the questions we've got about your life in the Netherlands and especially the start of your career here, and how it all turned out, of course, with you buying a house and all, living in Amsterdam, working in Amsterdam. So
Yeah.
you really did you really did well. So to everyone watching, thank you as well for joining in. Or also, if you are looking back at the webinar later on, because you will get a rewatch link as well. Thank you so much for watching, sticking with us. If you want more information, just contact us. You can send your CV on our website, and then we'll be in touch with you, schedule an interview, and you can ask other questions there as well. And we would love to talk about more about working and living in Netherlands. So for now, again, thank you, Raquel, and thank you everyone who's watching, and we'll be in touch. Bye bye.
Thank you. Bye.